Brain does not regenerate, but yes, it can learn again. So in any case, whenever there's a brain damage or spine damage, there's enough residual brain and spine present there which can be taught the function of the damaged part. And that's the whole principle for neuromodulation. Neuromodulation doesn't mean only surgical neuromodulation. It can be chemical neuromodulation, electrical neuromodulation, non-invasive neuromodulation, rehab-based neuromodulation therapies. So we at IBS hospitals I think we are one of the best departments in neuromodulation in the country as of now. In neuromodulation, the most important aspect is the patient selection. There are certain criteria to be fulfilled. And then our approach is that whether we can solve it by neuromodulation-based rehab therapies alone, whether there is a role for medical management before we switch on to neuromodulation-based therapies or surgeries. If the medicines don't help, then we assess if it's a case for non-invasive neuromodulation. It's something that can be done by a machine placed outside the body without any surgery. So the whole team decides. It's not only one person. Neurologist has to be involved, neurosurgeon has to be involved, rehab specialist has to be involved. At times the respiratory surgeons, urologists, all have to be involved in this. Our scope of neuromodulation covers almost everything that is being done all over the world. Right from the cranial stimulation, direct on the brain cortex, implanting chips on the brain cortex, to deep brain stimulation, that you do for Parkinson, where you implant some electrodes inside the deep brain tissue. And then you have high cervical stimulation for patients with coma and vegetative state. Then you have cervical epidural for people with paralysis due to neck injuries. Then we do brachial plexus stimulation for arm injuries. Then you do epidural stimulation, lumbosacral, for people who are paralyzed below the waist. Then do sacral neuromodulation for people who have bladder bowel control problems. Then you do vagal nerve stimulation for stroke, for epilepsy, other disorders. And then we can do peripheral nerve stimulation for disorder like sciatic nerve injury. Then also we can do spinal cord stimulation for pain disorders. In chemical neuromodulation, we can do intrathecal drug implantation system like pumps. So these pumps can solve the purpose of pain alleviation or reduction in spasticity in cases like brain injury or cerebral palsy or stroke. These are operative approaches I'm talking about, but many of them can be done non-operatively also by non-invasive method. And very proudly we are the ones who started that here, and we have been part of some very successful international trials for the same. We are able to now cut down on number of surgeries required, but because that again can be achieved by non-surgical method, by non-invasive technologies. And even to improve upon the results of the neuromodulation technology, surgical one, so we can add rehab therapies which are neuromodulation based. So we have a very robust department for that, and it's not conventional physiotherapy. We don't just learn to live with the mobility or disability. We want to alleviate the disability and recovery of the neural function. We don't accept paralysis.